why is it that we are talking about community and system change? Because I think that it's critical that we need to be able to move away from blaming the victim in the individual to looking at the socioeconomic and political circumstances in our community. And so when we talk about policy and system, we're referring to changes in community norms, changes in organizational practices and policy, administrative, regulatory policy, and we also addressing legislative laws that are passed at different levels of government. And so the model that I have been able to work and develop throughout the years is based on a community-based participatory action research. It's a model that I started very early on before people used to call this community-based participatory research, because one of my degree is in social work, and one of the areas that I specialized was on community mobilization and action. So when I started doing research in academia, it was very normal, for me to just involve the community and mobilize the community, as I always have done for other kinds of purposes. So the model calls in phase one to be able to engage in the community entry and identify the gatekeepers, and then be able to have dialogues with community groups and define the problem collectively, and be able to engage them, involve them, either in a coalition building or partnership or any other kind of form. And once you build that group, you really need to nurture that. You need to deal with the group dynamics. You need to develop leadership, group norms. You need to strengthen that relationship before you move them into the capacity building, which is further training on the topic area to be addressed, and to really get them to become an expert on the topic area that are being alluded to. And then you also have to engage in participatory action research methodology that the community feel comfortable and for which we could train them, educate them, engage in capacity building so they could be able to conduct the research. The other part of the research is the fact that they need to then actively be engaged in the assessment and data collection and analysis and interpretation of the data, because we researchers, even though I'm a minority, I'm still removed from that community, and they know better than I about how to explain some of the significant findings that sometimes only them could really speak out. And obviously, in the assessment aspect, they are the one who could decide, if they want to engage in community mapping, focus group, telephone survey, household survey, et cetera, photo voice, which are used often. So qualitative and quantitative data methodology is one of the things that we train them, educate, facilitate among the community to become expert in engaging in those kind of activity. And then move them into dissemination. So they, through community forum, town hall meeting, to get them to really share with others and increase the coalition membership. So then through the development of an action plan with clear goals and objectives and strategies and an evaluation component, they could be able to move into that direction. And participatory research is very important because of a series of limitations in doing research, in mainstream university, and here in this particular slide, really give you an idea about the differences that exist between the two primary methodology here. Action-oriented is flexible. It has considerable amount of community participation. There's shared governance. There's the opportunity to share funding, jobs, training, et cetera, and it really stresses community asset, and the contrary to the other mainstream kind of research that you see here to the left. And then the partnership building is very critical, particularly to involve those sectors that need to be involved in, depending on the topic area, in addressing the social determinants of health, from the media, education, health professionals, faith-based community, business sector, a number of sectors that needs to be brought together, as we already have seen in the Left Move campaign on reducing obesity. So the first example that I'm giving you is an example about environmental health. This happened in Blue Island, Illinois, which is a community, a working class community. They came to us. So this is an example of community initiating the research, because research not always is initiated in the university, actually should be initiated from the community. So it turned out that during that period, we were already releasing some data on asthma research, and the community read that article, immediately approached us. I didn't know them, they didn't know me, and they said, we have this serious problem of poor air pollution in our community. We cannot get the attention of public and elected officials because they think that we're making up this aspect of how the air pollution of this Clark oil refinery